Hey guys, if you're like me, you like to get in and out as quick as you can, right? Time is valuable, time is important. The best way that you can do that here in the office is to set up your appointment and keep it like clockwork. For me, I have it in my schedule. I know what appointments that I have, and I just kind of live by my schedule. One, it takes the brain out of it, so it makes my life a little easier. And two, I just kind of keep running on that clock. And so if you have an appointment, say at 3:15 on a Wednesday, it's very simple. Come in the door at 3:15, go ahead, use the bathroom if you need to. You already have your card to scan in. Go ahead and use that. Wait for the beep, and then depending on how many people are here, it'll call your name back to the table. Just a reminder with that, if you have some spare time here before you head back to the table, use these wobble cushions. Get that spine moving again. Maybe you just came out of a meeting, maybe you're sitting at work for the majority of the day, maybe you're just waking up and you're getting here early in the morning. No matter what it is, if that spine is moving before the adjustment, you're gonna get a better adjustment. Just try not to strain it before the adjustment. So as it calls your name back, it'll call you to 1, 2, 3, 4, or 5. We'll just pretend that it called us to table number 2. And so as we run around with our key tag one more time, click on where it says scan and then place this under. You'll hear the beep. Once you hear the beep, that's gonna pull up your information. Go ahead and put all your belongings here and then just go face down on the table. This is a great time to get some alone time. Relax, no texting, totally out of gravity. I get it. Some of you guys might have some issues laying on your tummy or chest, or maybe it's acid reflux. If I've talked to you about this already before, go ahead, lay on your back. But what I want to do is get your body out of gravity. So either it's face up or face down, preferably, lay out of gravity so that way your body can prepare to get the best adjustment possible. As I come around to you, I'm probably gonna touch your leg. We're gonna look at the screen right there. I can look at your x-rays, the last time you've been in, make sure that everything's all set up, and then we can start on that adjustment specific and custom to you, okay? Oftentimes we'll ask you, is there anything new or different, right? And so I wanna make sure that we're progressing in the right direction, but I know, many of you guys have come in with a laundry list of items. I know it, you know it, and we both know that it's gonna take some time to heal, right? And so I'm not gonna ask you how you're feeling because, you know, just like the stock market, there's gonna be some up and down days, but what I wanna see is some trends of it moving and progressing in the right direction. However, if there's anything new, maybe you fell on a hiking trail over the weekend, or you're playing with the grandkids and you're kind of hunched over and now it's in a particularly bad spot, briefly mention it to me. I can double check that area, but a lot of the times, to be quite frank, it's not even gonna, it's not gonna change the direction of the adjustment. The adjustment is still, it's gonna be custom to you. So the testing of the legs, me finding the subluxations, those areas of fixation and or misalignment in the spine, that's part of that test that we do every single day when you come in for the adjustment. So after the adjustment, you got the stress off the nervous system. Again, the adjustment doesn't heal you, doesn't necessarily make you instantly feel better, but it does allow your body to heal itself better because the interference is less, right? And so please be careful as you're exiting the table, kind of relax, slowly come up, make sure you have your bearings. And then it's really important to come over here and work on the rehab. So everyone's rehab should be a little bit different. If you've been doing the same rehab for the last, say, 5 months, it's time to step it up, right? And so we wanna make sure that you're making those positive improvements. So on here, we have a list of 16 different exercises. And so we're gonna choose one that's gonna kind of step up your game. Again, help to hold the adjustments so that way you get better faster. I can't wait to adjust you this week. Great exercise for when the piriformis, your low back is restricted. Grab a lacrosse ball and an open wall. You're gonna work this not on the spine, but off the side of the spine, in the glutes, glute medius against the wall. Do this for 30 to 60 seconds each side. Hey you, are you on your phone? Are you looking at Facebook? You know, the best way to promote small business locally is to check in when you're there. We certainly would appreciate you here at Wellness Key. So if you're on your phone right now, if you're cruising around on Facebook, like a post and check in, and we'd certainly appreciate it. Can't wait to adjust you. Great exercise to help strengthen, stabilize the spine, increase proprioception, helping you to hold the adjustment. Maybe you're unable to do the vibe for whatever reason right now. Grab a large wobble disc and march in place. This is going to, again, work on that proprioception, work on your balance, and work on your coordination. Do this for 3 sets of 1 minute each. Most of us have been in a car accident at some point in our life, right? But did you know that out of 100 car accidents, even minor fender benders, 98% of them have some degree of loss of curve in the neck? The average person in a car accident loses half their range of motion in flexion, almost half their range of motion in extension. All of these things can be restored by gentle, safe, and effective chiropractic care. We'd love to help. Hey guys, Dr. Joe Utash here, Wellness Key Chiropractic. Today we're going to show you the lateral cervical flexion exercise. Fantastic for lateral flexion of the neck. Great at releasing some of the nerves in the lower part of the neck that may be causing kind of numbness, tingling in the hands and the fingers, neck pain, shoulder pain, trap pain. Loxy will demonstrate this. You're going to want to do this on both sides, or I may suggest on your paperwork that you're doing it on either side. You're going to be looking straight ahead on your side, and you're going to lift your ear to your shoulder and then relax it back down. A nice smooth motion. Start with 10 per side. Excellent. So you may find this challenging at the beginning, and you may need to start with a different exercise to start with. So instead of laying on your side, you may go against the wall and just bring your ear straight to the wall and back up. Ear straight to the wall and back up. One thing to be cautious of is to make sure that your nose is not rotating. That's kind of a cheat. And so make sure that you're going straight lateral and bring it back up. Again, this is lateral cervical flexion exercise. For those of us with stuck, tight, aching, burning, maybe even numbness down into their shoulder, into their arm, lacrosse ball in the back of the shoulder, great exercise. So you're gonna get a wall, you're gonna get a lacrosse ball, and you're gonna place the ball in between that. You're gonna work this area, kind of tracing the scapula on all sides, working through here. You may even work on the side of it and kind of working against the wall all in through here. Miguel, go ahead and demonstrate that for us.
So we can go up and down like you're squatting, or if the squatting is too much, you can also get the arm going.
Awesome. An ounce of prevention is worth a pound of cure. Every day we see new patients that come in here who are suffering with headaches, neck pain, back pain, all sorts of health issues. And the common thing among them is that they wish they would have started something earlier, or they wish they would have done something earlier to prevent the suffering that they're going through right now. And so this Mindful Monday, take some action. An ounce of prevention is worth a pound of cure.